My name is Barbara Steinacker, and today I want to talk about my poster presentation, Individual Modeling of Chemotherapy-Induced Haematotoxicity with NARX Neural Networks, a Knowledge Transfer Approach. My poster is part of the MLSCB COSI, and you can also search up our paper, which is of the same name, which we recently published. This is how my poster looks like if you want to find it. So I will just go through the individual sections of our poster. So why are we modeling haematotoxicity? Cancer patients receiving chemotherapy experience severe side effects, and this reaction to chemotherapy is very individual. So predicting a patient's hematologic response is of high clinical relevance, but difficult due to high between-patient heterogeneity. And comprehensive mechanistic models exist for this task, but we observed some patients which exhibit cortex dynamics which cannot be predicted. For example, you can see here on the right side, these patients show highly irregular dynamics and cannot be predicted by existing models. So we thought if hypothesis-free machine learning can be an alternative to semi-mechanistic modeling here. For this, we use so-called NARX neural networks, which are recurrent networks based on nonlinear auto-recursive exogenous models. And they also have an exogenous input. In our case, this is the therapy administration, for example, concentration time profiles of different drugs. And then the regressed variable is, for example, the cell count of neutrophils. But of course, you can't just use a neural network on very few patient data. So an individual patient's data is very sparse, and training a neural network on it would not work out because you have much more variables than you have time points for training. So we thought about using transfer learning, so we can include some biological knowledge into the network by using for example, a semi-mechanistic model to simulate a lot of training data, which we can pre-train our network on. So by this, we can, for example, simulate a virtual patient population with a semi-mechanistic model, and by just setting different biological parameters, train and validate the individual NARX networks for each parameter set, and just do multiple therapy scenarios. So we have lots of setups and data. And with this approach, we can test the feasibility of our knowledge transfer. And finally, after we validated our approach, we can use this transfer by fitting individual patient data with first the semi-mechanistic model, simulate lots of data for this setup, train a NARX network on it, and then fine-tune a NARX network on individual patient data. And for our feasibility approach, we had very good performances of the trained networks, even for extreme settings of biological parameters. So our NARX networks can even simulate very extreme dynamics. And we observed that the performance mainly depends on scenario complexity. We avoided overfitting by employing multiple model reduction methods. So we are very confident to employ our models on real data, which we also did already on some patients of the NHLB study. So here we are modeling leukocyte data, and our approach was as follows. We first fit the data of the first 2 treatment cycles with a semi-mechanistic model, simulate lots of data with this fitted semi-mechanistic model, and train a NARX network on it. So, and then we can fine-tune a network again on the data of the first 2 treatment cycles. And finally, we compare the 2 models based on the data of the 3rd to 6th treatment cycle. And we can see the NARX network performs a bit better than the semi-mechanistic model here. They look very similar, but if you look closely to the individual days, the points out by the NARX network are a bit closer to reality. So in conclusion, our hypothesis-free network approach is capable of reproducing the dynamics of a frequently used semi-mechanistic model of hematopoiesis. In the next step, we impose stochastic and long-term chemotherapy effects on this type of model to explain real-world patient dynamics, and we of course also want to do a comprehensive comparison. If you're interested, please check out our publication, and if you want to contact me, here are my contact dates. Thank you very much.